people did wait to come together to celebrate that person's life. As of yesterday, there's 63.6% of Albany County's population has received the first dose of the vaccine. 57.5% have been fully vaccinated. And looking at those 18 and older in Albany County, 74.3% to date. Albany County has now administered or reallocated nearly 70,000 first and second doses of the vaccine. Thank you to the Department of Health, Whitney Young, to all of our partners in the community that were making this happen. But again, you do this in a partnership. And while we were able to just, at our vaccine clinic, we had over 200 second doses at our Capitol Center on Thursday. Only 6 people came in for the first dose. So we are seeing that change. That's why I said at our last briefing, talked about, you're not going to see the big pods. Things are, we have to go to smaller pods, and to the ingenuity of working with the health department and everyone else about picking seniors up over age of 60, bringing them in, and getting it done. One of the good things is I think everyone saw the weekend, the governor did put out, once New York State gets that 70%, all these restrictions are going to go away, which we should be there hopefully in the next week or two. But I know he's leaving into place nursing homes, schools, and other things, and we know the confusion that happened when we said we're going to drop the mask in the schools versus the other stuff. I said to people, we've been doing this for 15 months. Take a step back, take a deep breath. Just remember, it's been a marathon, not a sprint, and we'll get through it. But when they put the first guidance out, wait until it's official, and that's been like the problem. I know like a lot of the state agencies are still all have to wear a mask and complying in our building. If you have the vaccine, you showed your COVID-19 card or your passport, you don't have to wear your mask, and you don't have to go through the steps of somebody that has not had it. I know in the state, they're still waiting for guidance from the state health department for the state agencies that are fully complying. I just had military this weekend, and we all had to wear masks. And let me tell you, the military personnel had the vaccine since December, but there's no guidance. So until that, it takes time. Get used to it. We'll get there. That's why you're not going to see the large-scale pods that we've been doing. And I do want to say to Dr. Whalen, to her staff, thank you so much. They did a great job. Everyone did, and to the volunteers that made that happen through our volunteer network and everything she's done, and the people that just showed up and helped out, thank you so much. We can never thank you. Can't give you enough pats on the back. Can't give you enough awards to say thank you. But some of the things we're concentrating, we have been, is the smaller stuff. So I do want to say the Capital District Latinos gave out 21st doses and 39 second doses yesterday. These are working, the smaller ones. Like I said, we have pods coming up on Wednesday at Queens Landing Park from 4 to 7. And we're also hosting a vaccine clinic on Friday for the Juneteenth block party in Albany at the corner of Broad Street and Alexandra Street between 12:30 and 3:30. We also have another clinic at West Hill Refugee Welcome Center in Albany on Tuesday, June 22nd, from 4 to 6:30 p.m. The Pfizer and J&J vaccines are available at all these pods. So please, I know they're still keeping the Lord & Taylor's old building. Crossgates is still up and running, and the Washington Armory, I believe, is still up and running. So they will stay, that pod will stay that size for the time being, but you'll see us changing gears a lot more. So also, residents can get the Pfizer vaccine any day during the week at our County Department of Health at 175 Green Street from 9 to 3. You don't need an appointment. You can just walk in. If you're walking by and you decide you want to get it, you're driving someplace and decide you change your mind, come on, pop down. If not, you still can talk to somebody. They'll talk to you, answer any of the questions that you have. I have said to children, or parents with younger children, talk to your pediatrician. Let them walk through you. I'm not going to sit there and tell you, especially between 12 and 16. That's a decision you have to make with you and your pediatrician and going forward on that. Like I said, we still have the free transportation, so please call 518-447-7198. And if you're disabled and you can't get out, we've been running that program, but we will come to your house and get you the vaccine. So we've made it possible for everyone to get it. And again, you can call the same number, 447-7198. As of today, Albany County to date has 24,382 cases of COVID-19 in Albany County to date. There's an increase of 2 positive cases since yesterday. Over the last 5 days, there's been an average of 3 new positive cases each day. Yesterday it was 4. The new positive cases, we also both have close contact to positive people, 24 active cases in the county. This is the lowest it's been. That's currently 50 people under mandatory quarantine. Yesterday, the number was 61, so which is good. This is the lowest it's been since last fall. So, the light's there. We're about to come out of the tunnel. We're almost there. People stay, vigilant. Continue to do what's right to get forward and hopefully have some type of normal summer. There were 6 recoveries since yesterday. 1 new hospitalization overnight. 3 people are currently in the hospital from the virus. Yesterday we were at 3. There are 2 patients currently in the ICU. Yesterday it was 1. Again, we urge people to get tested if you think you need to. Still wear a mask if you're not fully vaccinated. Cough into your arm, clean your hands, stay 6 feet apart. And if you are vaccinated, still clean your hands, cough into your arm, and be part of the solution, not part of the problem. Just because you have it doesn't mean you can't spread it. Please continue to do all this stuff, and we will get through it. You can go to our albanycounty.com for more information on this stuff. Some of the good things that are going forward. Well, next school year will be starting just around the corner. One of the things that's been a burden, not just on schools, but on parents, on teachers, on administrators, was figuring out this new world and how to do school and socially distance and try to hold it via Zoom. So our Department of Health has been awarded $6.6 million in reallocation that came from the federal government, Biden administration, to help continue in learning for the fall time, so to help the school districts with to make sure that they can provide COVID-19 testing, make sure all the barriers are in there, and to make sure that kids are back in the classroom. I know that's been a big push for the President Biden and his team to make sure that the school year is back. I talked to some parents over the weekend. I don't know what the summer school is going to look like. I don't think they'll be ready for that, but the fall we need to be ready to be fully back in person and hopefully not wearing masks. But this funding will be used for public, private, private BOCES charter schools. Everyone's eligible, and we are in a good terms of our infection rate with hospitalizations and everything else. So I don't want to listen. I'm not going to look at my crystal ball and say to the parents, hopefully the mask and everything will be back to normal in the school year and you won't have to worry about this. But for the schools to be able to use this money to help offset and without raising taxes and to make sure, or diverting from other programs they had to last year. Dr. Wynn will be talking about it too, and hopefully, I know they can't go back on the money they spent, but this will help budget and make sure they have the tools in the arsenal to move forward. But this funding gives teachers, parents, and administrators the peace of mind they deserve, knowing they'll be able to test as needed. Since the outbreak started, we've had made equity a priority because we knew Albany wasn't spared when it comes to racial inequality with COVID-19. All around the country, we saw COVID impacting black and brown communities more than white communities. So I'm proud that Albany County could be the first county in the state of New York to develop a mobile COVID testing program that brought disparities needed resources to underlying communities. So one of the things we did notice as when I talked to other county executives when we looked around this nation was that the neighborhoods that were hit the hardest weren't getting what they needed. So to help identify COVID-19 in these communities, we did the mobile testing so we could see quick results other than later, and to make sure that we are making every effort to give people the opportunity to come to a street corner to get tested. So I'm excited to announce that this program has earned us the Gold Innovative Practice Award from the National Association of County, City, and Health Officials. The Gold Award represents the highest level of program innovation according to the organization. Our health department is 1 out of 8 only that received this gold award for the standard practice that we put into place. This recognition of this incredible work is done by by my staff, the entire county workforce, and of course our partners who helped us make this happen, and that's Whitney Young, and I want to thank Whitney Young for everything they're doing. But I especially want to thank my deputy Dan Lynch, Mike McLaughlin, Luke Rogers, and Pat Elders in my office, who we started this program, came up with a concept, and with Whitney Young and Dave Sheppy made this happen. So I want to say thank you to everyone involved with this, especially Whitney Young. But Dave, please.
All right, thanks, Dan. Again, it's lovely to get the distinction here in the town and region that we operate in. As you highlighted, this wouldn't have been done without an incredible level of partnership, and I think, as Dr. Whalen and I have probably commiserated over the last 16 months or so, out of something not so great comes a lot of great things, and I think we've highlighted the great work that can be done with healthcare organizations that operate out in the community with public health departments and with county government. And Dan, you highlighted the great work of your own staff to make this happen. Just a shout out to Dr. Whalen and her staff for pulling together the pieces that they've been able to do for this. Also, I think we also looked to Craig Apple and his staff, and we need a bit of orderly presence when we got this started. He was able to deploy some folks to help out with that, and at Whitney Young, a number of staff that stepped up, that didn't really sign on for this when they came, but I think we're nimble enough to react and to do the right thing. It's not lost on me that here we are in 2021, and that this actually marks the 50th year of Whitney Young's existence. Having started in Arbor Hill, but now getting around the region a little bit. So, it was indeed not lost on many of us that in that 50-year stretch, the time that we have been through in the last 16 months is probably some of the most telling times of what we've seen. But the ability to react and respond, and to be a resource not only in Arbor Hill but in a number of underserved communities. So through that time, we were able to test over 7,000 people in those neighborhoods. To date, we've vaccinated over 8,000 folks in many of those same neighborhoods. And again, the majority of those people being black or brown or people of color. And it's lovely, I think, for the region to get this distinction, and particularly for the local health department here to get the distinction of this innovation. It's unfortunate that getting to communities of color seems to be innovation worthy, but the reality is that this is the work we do, and just like any guy on the street that helps in a crisis and wants to be anointed hero status, this is the work that I think we should be doing. And the Innovation Award is great, but we're just delighted to still be able to be relevant and to be able to step up in a scenario like this. So again, kudos to you, Dan, for leading this effort on the county's level, and for making your staff available to us to make a lot of this happen, and for Dr. Whalen for liberating her staff to do things that, again, probably were outside of their norm. And again, that didn't stop with the testing effort. It's truly been the same drill through the vaccination effort. And the ability to work with that, I think, only opens doors for lots of other things. So hopefully we don't replay this drill anytime soon.
Hopefully not.
But I think we have the bedrock foundation for a lot of other great work. And the last point I'd like to make, and I'm sure Dr. Whalen would nod in affirmation as well, is we've learned a lot of things that we are not, that we can do, that we are not normally able to do within the regulatory framework that we operate in the healthcare environment here. And I just want to highlight one example. So when you are out in schools now doing vaccination clinics, and you're able to vaccinate the 86-year-old grandmother who brought the child there, and parents in their 50s, 60s, and other relatives who bring children to those schools, in the normal environment, we can't do that regulatorily. It says that we can do a lot of great things in healthcare if we just think outside the box a little bit. And so, this is partly, it's a lot of a plea to say, let's think at higher levels in the regulatory framework about the things that we can do that would not put anybody in harm's way, but actually achieve a public health agenda. And I think if we want to get to health equity in the communities that we have served, we have to look at that model and the things that we've learned. And again, this has been these are things that are done in other states routinely. We just haven't been able to do them in New York. But again, the silver lining in this pandemic has been a lot of other great work can happen if we only use a little ingenuity. So kudos again, Dan, to you and to Dr. Whalen for the leadership on this.
Dave, thank you. And you are right. So many things have changed, and we have evolved. And again, under Dr. Whalen's leadership and everyone at the Department of Health, how we continue to go forward. So, Dr. Whalen.
Thank you, County Executive. And I'm so pleased to see Mr. Shippey here this morning. It has been a really fruitful collaboration since day one. But I would like to say that Whitney Young has been a partner, and Mr. Shippey has been a partner to the Health Department for as long as we both have been in existence. We have a mutual mission to promote health equity in the communities that we serve, and whether it is diabetes, whether it is asthma, whether it's moms and babies, we have worked and partnered together for many years to ensure that we can get health equity, which is still elusive to us. There are still major health disparities, predominantly with Black and brown communities in Albany County and other areas of New York as well. And I think that, as Mr. Shippey commented this morning, having the ability to be creative within the public health sphere really shows us the work that we can get done. We have learned through the years, and it's been highlighted by the pandemic, that a public health outreach, a public health approach, even a medical care approach is not a one-size-all for everybody. And we have to make sure we can meet people where they live. And this is an important highlight of how we were able to do this. But going forward, we need to continue to do these kind of efforts as we have in the communities, with more ability to be creative and to work together within the community. So I look forward to continuing to move forward with this. In terms of COVID, the numbers are looking good. We are seeing decreased cases in the community, decreased hospitalizations, and we're seeing increased numbers of individuals who are being vaccinated. This is all getting us to where we want to go, and we know right now our immediate goal is to getting to that 70% of all eligible people, so that we can look at rolling back a lot of the restrictions. It's been a challenge, and I know the county executive talked this morning about school-age children, and for parents it's been very difficult. The kids have been great, the schools have been great, and we continue to work with them. The money that we have been awarded is going to require a bit of planning, but we also have to realize we're in a shifting landscape and don't really know as yet what the landscape vis-a-vis COVID will be in the fall. But we want to ensure that we have systems in place that will enable in-person learning. We know that there's been a disproportionate burden on families, and particularly on women, with the work from home and with school from home. And we want to be able to ensure that we can have kids back in school. We want to make sure that their mental health is good. We want to make sure that they have the ability to learn in the environment that they learn best in. And so we will work very closely with the schools to enable a framework to ensure that we have appropriate and immediate access to testing if needed, to controlling any cases in the school. This is going to be a really comprehensive approach, and it is something that we are designing in conjunction with our partners at NYSHO, but it is going to be chiefly a localized approach. So the local health departments will be working with their school districts individually to come up with the best plan that will work for our county. So we look forward to that. We're rolling up our sleeves for another initiative, and this is going to be an important one. We know that. We've also transitioned this week. This has been a major transition for us away from doing the large-scale pods at the TU. We had our last second dose pod at the CAP Center on Thursday, and we won't be doing that again in the foreseeable future. From now on, we will continue the efforts that we have been working towards since the beginning of the pandemic, which is to vaccinate people where they live, work, and pray. We are working with many community partners on that, and Whitney Young has been a fantastic partner, along with all of our other community-based organizations and hospitals. We continue to meet biweekly with those partners on the hub calls and have discussions with many people through the community who are interested in having pods. And as we can have them, we will have them. We've had some success in places like Capital District Latinos. We look forward to going to the South End Juneteenth Block Party. We are working with the Refugee Center. There are many extensive community outreaches that are going on. These include not only vaccination efforts, but community health workers who are out ensuring that public health education continues, and the community health workers can connect people to other programs and services that they may need. But again, it's all important to get the right information to make the informed decision for you and your family. So if you get that from a pediatrician, from your primary care doctor, if you get that from the health department, or if you get it from a community leader, one of our community health workers, or our website, please continue to educate yourselves, to ask questions where you need, and to make sure that the sources of information that you are utilizing to make decisions are based on evidence. We look forward to continuing this work. It's going to be continued busyness through the summer to get the vaccines out. We continue to vaccinate daily at the health department down on Green Street and invite anyone who hasn't yet been vaccinated. We have Pfizer and single-dose J&J at the health department, and it's quick. If you come down, we have nurses that are happy to see you, and there is no charge. You simply need to present a license, and you will be vaccinated, and we'll see you back if it's for a Pfizer vaccine. If it's J&J, it's one and done. So we look forward to continuing to serve the Capital District, to continuing to serve the county moving forward.
Thank you, Dr. Whalen, to you and your team, and to Whitney Young, thank you. I mean, again, it takes partnerships. I've said this before. I've said this for the last 15 months or the last 66 weeks. Leave the egos at the door. There's time enough to get big heads when this is all over with. But right now we need to work together for the people of this county and for the Capital District and for the state of New York to get it done so we can get through this health crisis. I did hear from one constituent that they got charged for getting a vaccine shot. You should not be charged. If you get a bill, you should not pay it. The Biden administration has coverage assistance fund created for this reason. So we told the person, don't pay the bill, and then submit it to this fund, because no one should be charging you for a vaccine at all, even your own doctor. I mean, you got your co-payment if you go to your doctor's office, I get that, but they should not be charging your insurance or you for the shot. So we also, if need be, we will also contact the state attorney general office or the Department of Financial Services to bring it up to their attention, make sure this isn't happening. Reason why I'm putting it out, I want to make sure if anyone's watching this or listening to this, if you have been charged, you shouldn't have been. If you paid it, you shouldn't have paid that bill. So. One of the, switching gears a little bit before we end, is one of the things that have hit the hardest through this COVID-19, not just the mental health, but the wear and tear on children and parents, and Dr. Whalen said it right, women that had to stay home, but was with people with addiction. People's addiction, because of the health crisis we're going through, fell back into that trap, back into, unfortunately, them bad habits that they had before they got the recovery they needed to live a healthier lifestyle. And they always say it's one day at a time, or keep the change moving, or to plug in the jug. And unfortunately, because of the world we're in, they couldn't handle it, and we've gone backwards. So as of today, we've reported how deadly the 2020 was in terms of the opiate overdose of deaths. And sadly, 2021, because 2020 was bad, it was higher than 2019, higher than 2018 and 17. And unfortunately, 2021 is looking to be even deadlier. There are already 37 confirmed opiate overdoses in Albany County through the end of May. Additionally, there's 13 suspected cases still awaiting toxicology reports, which could mean a total of 50 for the first 5 months of this year, which is alarming. Fentanyl was present in 89% of these deaths. There was a total of 99 overdoses in the county in 2020, which was up from 62 in 2019. To put things in the right light, we had 50 people die of overdoses in 2017, like I was saying earlier. It's hard. I watch family, friends that have addiction issues that have fought this, and for whatever reason, it has rocked their world, and they are struggling. So if you know anyone that has been sober, sobriety, from drugs, alcohol, whatever it might be, reach out to them. Just make sure that they're okay, because unfortunately, what's going on is not good in this, not just the county of Albany, but in the state of New York and across this nation. Our opiate task force will be regrouping at the end of the month, where we have a draft overdose plan for the end of the month, for a spike plan that will be presented, along with more effective prevention and education framework that we'll be launching at the end of this month. I'm also happy, so happy, I went to a press conference with the state legislature, passed a bill before the end of session that requires any funding that comes to New York from opiate settlement to be used for addiction, treatment, recovery, and prevention services. If people realize if you had an addiction problem, you could go away for 30 days. If you need to stay another 30, you could do it. Now you're lucky if they approve you up to 3 days to 10. You're not gonna recover in 3 days to 10. Insurance companies have made it so hard to get the treatment that you need, and some people can do it on their own. Some people need help. Some people need to go away and get into a different routine of life. So I do want to thank John McDonald, Fahey, Breslin, and I think it was Kerry Warner led the charge on that to make sure that this bill would happen. One of the things when we took on the opiate giants ourselves here in the county, and that's all, the whole settlements are all starting to come in by the fall. Couldn't get any help out of New York State, nowhere to be found. Our Attorney General at the time, not now, Trish James, has been phenomenal. Settled for like $30,000, and I took that fight on, David versus Goliath, and we had prevailed. And unfortunately, when money comes in, you have the money grab, and I do want to thank the partners up in the Senate and Assembly that signed on to this bill, and hopefully the governor signs this, that this money will go to the people that need it, not to offset other things, but to give it to the money so people can get their life on track and get moving forward, and give them the resources that they need. So we need the governor to sign this legislation into law, and hopefully he does this. Before we also end, I also want to recognize, and it's been great because you're seeing now we're starting to go into different directions, and government still runs. As much as everyone knows, we've been on the COVID-19 for 66 weeks. Other things continue to happen, but I can't say this enough without thanking our DPW and our Department of Public Works for the safety program, and also Bill from the Albany County and the Albany Capital Region Safety Kids, who we partner with. They hosted another child safety car seat checkup at Crossgates Mall on Saturday, inspected over 50 cars. Of those that were inspected, only 2 seats were installed properly, and 4 were replaced because of damage, or they didn't meet the child's age group that they should be in that car seat. So I do want to say thank you. I take a lot of pride in this. We haven't got out to it because of COVID, but we started it up again. I made a ton of bets with a lot of people that they didn't install their car seats, right? And you know who you are. I'm not going to call you out. But I will say this, I was correct, and again, they do it, and we provide car seats if you can't afford a car seat. So please come out to this program for the safety of your child in your car. Have it done right. Those who want to get vaccinated at state-run sites, as always, can call 1-833-697-4829 to United Way, to the partnership with Pecan and everyone at United Way. I can't thank you enough for everything that you've done, and we appreciate it. I know they're not getting many phone calls anymore, but thank you for being a great partner. You can always go to our website, albanycounty.com, to get information. To the mental health support hotline, it's probably coming to an end because they're not receiving much phone calls anymore, which is awesome. That means people have gotten the questions they had or the anxieties that they had are coming to an end. But it's still available right now from 8 a.m. to 5, 518-269-6634, and our 24-hour sexual assault hotline number, 518-447-7716. So please, again, do the right thing out there. I do want to say to David Cheppy and to Whitney Young, to Liza, but especially to my team, I just had a little conference with Mark Pullencards out in Erie County and other county executives and county managers, and we were all talking, and no one will truly understand the hours that we put in, the things we had to do to get to this situation. And I'm talking 17 hours a day, 7 days a week, when everyone else was home doing the right thing. Our staffs all got burnt out, and I can't thank them enough for thinking outside the box. And Dave, you said it correctly. We have learned things we can do. Hopefully the state learns from this. Department of Health, the State Department has done the best job they can for the situations they've been in. But we learned a lot, and again, I can't thank everyone enough for everything that they have done. And receiving the Gold Innovative Practice Award from the county and city is just awesome to say thank you to not just my staff, to the health department, to Whitney Young. That extraordinary things we can get through, and to have this award is great, and the $6.6 million. I wish we had this last year for schools. We're in the heat of this, but look, we'll take it and we'll make it happen. And again, to Dr. Whalen and her team for making that happen. Thank you. Please stay safe out there. Do the right thing. Any questions?
Okay, so my questions have to do with the vaccine distribution in the school setting. Last week, Governor Cuomo, he emphasized getting eligible students vaccinated before the end of the school year. And like you said earlier, we got like 2 to 3 weeks left. Is this an effort the county is supporting? Is it realistic?
So certainly we're supporting vaccinations within the school environment, and we have worked with our school districts and hosted a pod with North and South Colony last week and had good turnout there. We're also encouraging pediatricians to vaccinate within their offices, and I think Mr. Shippey can also comment on this, as there are school-based health centers in Albany County schools that through Whitney Young are also conducting vaccination efforts within the schools.
Yeah, correct. So the school-based health center environment is set up through school, and then also the mobile health unit that we use to get into the neighborhoods is still available, is still being deployed as those requests come in. And I think at Whitney Young we also provide the option for some of those families, and actually we've had a lot of turnout. We have 2 walk-in times per week at Whitney Young here in Arbor Hill, where folks don't need an appointment, they don't need to be pre-registered, and again, they can show up and get one of actually the 3 vaccines that are available. Like I said, a fair number of families are showing up where the whole family's getting vaccinated. So again, the right approach, not always school specific, but that is one of the options that we'll continue to keep open.
Are the school districts, are they like willing to host these pods? Are you having a hard time getting them to get on board with hosting pods in their district?
Our experience is no. As long as we're coming with the vaccine, there are varying levels of cooperation relative to school nurses that are helping versus those that may be not so anxious to help. But yeah, there's a fair amount of flexibility in a number of the districts that we've worked with to make this happen. So again, how nimble they can be when they don't have a lot of kids actually physically in school, so it is accommodating a lot of visitors and things. It's different when a kid normally shows up to school and that's the only population to be vaccinated. But I think it's been more receptive than I would have envisioned. I will say that. So I've been pleasantly surprised.
And my last question, sorry, is the county supplying the vaccines, or is this coming from the state or something like that?
So in our case at Whitney Young, so at this point, all of the vaccine supply we've been getting is federal supply. So as a federally qualified health center, we've been eligible since early February to get a direct shipment from the federal government. So that's the supply that we have been using since the beginning of February. Previous to that, it would have been the state supply, right? Or in a couple of cases where, Dr. Whalen's been kind enough when we've had a couple of days we needed to buy with shipment and borrowed a little bit of vaccine and then replaced it. But
And our supply has come through the state. And we have been very busy with vaccine reallocation efforts. So if we have a partner that we know is able to vaccinate and needs the vaccine, we reallocate it to them. In a situation of a school, it would be our vaccine and our staff. If it was not a school-based health center, that would go in and vaccinate. Or we would partner with another agency, such as Colony EMS, or any other vaccine provider to go in and do this together.
Any other questions? Thank you, everyone. Stay safe out there.